Is today the topic is all about how to make the right breathing. Okay, so why we ended up the session now? So the day before yesterday, we did one pranayama in the evening session. After doing that pranayama session, the participant ended with a doubt that, am I breathing right or not? And they themselves found that the breathing pattern that they have followed whole through the life, it was wrong. Okay, so that is why I have made an attempt to give this session. Okay, so the session is about how to breathe right. Okay, so first, before seeing about how to breathe right, first let us see about what happens while you are having the respiration process. Okay, let me share you the picture. See, the respiration process is divided into inspiration and expiration process. So what do you mean by an inspiration? Okay, so the inspiration is nothing but the process of inhaling. You are inhaling the air, okay, inhaling the oxygen. That is called as inspiration. And what do you mean by expiration? Expiration is nothing but the exhalation process. Okay, you are exhaling the carbon dioxide, no, that is called as expiration. Right? So the air you are inhaling, it is reaching here the nostril, it is going inside down your oral cavity, it crosses the pharynx, larynx, everything, and this one is nothing but your respiratory tract. Okay, from the respiratory tract, it would be dividing down into the bronchial tubes. These are the tree-like structure is there, no? This is called the bronchial tubes. And these bronchial tubes would be ending up in the structure called grape-like structure, a bunch of grape-like structure called alveoli. Over the alveoli, you would be having the blood vessels. And by means of the blood vessels, the gaseous exchange would be happening. That is, the oxygen that we are inhaling, okay, would be transported into the blood, and the carbon dioxide from the blood would be getting transported into the lungs for exhalation. Okay, so this is what happening in the process of respiration. While you are respiring, you are taking the air. From the air, you are taking the oxygen, and the oxygen is getting transported into the bloodstream, okay, exchanged into the bloodstream, whereas the carbon dioxide from the bloodstream is again put into the lungs for exhalation. So this is what happening. And here, can you see? Can can you see? So this one is the, no, this is nothing but it is called the diaphragm. Okay, so diaphragm is the organ on which our lung is very nicely and cosily rested down. Okay, so and this place, the chest area is there, no, this is called the thoracic cavity. Okay, so this is all about the breathing. This is how the breathing is happening. Now let us move on about the right way of breathing. Okay, see what I have told you. See, this is the lung. Okay, and the lung is rested on the diaphragm. The diaphragm would be like this. And in Tamil, we call it to be Uddara Vidhanam. It would be sitting like this. Okay, and the upper place is there. No, the chest area, it is called the thoracic cavity, and the lower place is called the abdominal cavity. Okay, cavity is nothing but a place, just it. Okay, so this place and this place are divided by means of the structure called diaphragm. Okay, and what is there in this thoracic cavity? We have seen, no, your lung, your respiratory tract, your digestive tract, everything would be here in the thoracic cavity. Okay, and the abdominal cavity, what you would be having here in the abdominal cavity? Yes, your liver, gallbladder, your small intestine, large intestine, and kidney, everything here constitute here in the abdominal cavity. And these two, the abdominal organ as well as the thoracic organs are divided by means of the diaphragm. Okay, got it? Now, which is the right way of breathing? You are inhaling. Okay, when you are inhaling, you are taking the fresh oxygen inside, fresh air inside. In such a case, what your lung has to do? Your lung has to give space for the air that is coming inside, right? So, absolutely, your lung should expand. Your lungs should expand. So when our lung expand, it needs space for the expansion, right? So in order to give the space for the expansion of the lung, what the diaphragm here does, the diaphragm moves downwards. Okay, when the diaphragm moves downwards, what happens? So the diaphragm needs space to move downwards. So what happens now? The abdominal organs here would be pushed out. Okay, so when you are inhaling, the lung is expanding to give the space, the diaphragm is moving down. For the diaphragm to give space, the abdominal organs are moving outward. So when you inhale, your abdomen should go out. When you inhale, the abdomen should go out. Okay, right. Now you are exhaling. Okay, you are exhaling. What happened? What should happen? See, when you are exhaling, all the air, all the carbon dioxide that is accumulated, okay, that was drawn from the bloodstream and accumulated in the lungs has to be expelled out. Okay, in such a case, what you have to do? You have to squeeze the lung. Squeeze the lung. The lung has to be shrunken in order to expel the carbon dioxide out. If the lung is shrinking like this, then the lung is decreasing in its size, right? So then what happens? The diaphragm that would be here would be again, the space will be created here. Diaphragm would be moving up like this. When the diaphragm is moving up like this, the organs that came out during the inhalation process would be again going inside. So while you are exhaling, the lung is moving up, the diaphragm is moving up, the space created in abdominal cavity. So again, the organs are again placed in their original position. So when you exhale, the abdomen should go in, right? So this is the right way of breathing. When you inhale, your abdomen should come out. When you exhale, your abdomen should go in. Okay, so let me explain this with a. So here is the. Observe. Can you see? Is it sharing? Yes, friends. Can you see, friends? Yes. So this is the process of inhalation. Okay. You are inhaling, right? When you inhale, oxygen is entering, the lung is getting expanded. Okay. In order to give the space, what the diaphragm is doing, the diaphragm is moving downwards. The downward movement of the diaphragm pushes the abdominal organs out. Got it? This is what happening. So the abdomen should come out. Okay, the abdomen should bulges out. Okay, yes, whereas this, observe. See here, while you are breathing out. So here the carbon dioxide that are getting accumulated in the lungs has to be expelled out. Okay, so what happens? The lung is shrinking in its space. When the lung is shrinking, again the diaphragm is moving to its original place. So it is moving upward. In such a case, again the bulged abdomen would be again coming back to its original place. Okay, so this is what happening. So when you inhale, your abdomen should come out. Got it? When you exhale, the abdomen should go in. This is the right way of breathing. Okay, but most of the time, for most of the people, this process is reversed. This process is reversed. That is, when they inhale, the abdomen will be going inside. When they exhale, the abdomen would be coming out. Let me show you. See, this is the wrong way of breathing. Can you see? Sorry. Can you see, friends? Yes. See here. See this man. See, he is inhaling through the nose. Okay. So that time what happened? Observe his abdomen. His abdomen is going inside. Okay, and this man is exhaling out. The air is coming out of the nose. Okay, While doing so, the abdomen is coming up. This is the wrong way of breathing. Okay, this is wrong way of breathing. And observe his chest. When he inhale, his chest expands, but the abdomen goes inside. When he exhale, his chest is going inside and the abdomen bulges out. This is how most of the people are breathing. Okay, yes. So now we know that which is the right way of breathing. Okay, now let us know what are the factors that are leading to the wrong way of breathing. Okay, so the reason number one, how the people may breathe out wrongly means, see, most of the people would be breathing like they may inhale through the mouth and exhale out through the mouth also. Inhaling through the mouth, exhaling out through the mouth. You should have seen all the small kids, they would be doing like that. Okay, when you do so, what happens? See, when you are inhaling through the nose and exhaling out through the nose, what happens now? We are having lots of hair inside the nose. See, what is the functionality of the hair inside the nose? See, it would be protecting. It is a protective mechanism. Whenever a dust particle is getting entered through your into your body by means of the air that you are inhaling, that would be getting filtered by means of the hair. Got it? Whereas here there is no such protective mechanism, just like a hair. See, whatever you are inhaling, everything would be getting directly attacking your throat. Okay, so this is not a wise thing to inhaling through your mouth. So all the time you have to inhale only through the nose and exhale out through the nose only. That is why we are more prone to throat infection and more prone to tonsillitis complaint. Okay, when you are inhaling through the mouth, what happens? There is no protective mechanism because the air you are inhaling, it would be going inside through the nostril. It has to cross your pharynx, larynx, then only it will enter the respiratory tract. It has to cross lots of things. Before that, body protective mechanism would be acting upon the air you are inhaling and it would be filtering out the dust particles, and in case any infectious germs are there, it would also get filtered out. By the time it is reaching the respiratory tract, the air would be a pure one. Whereas when you are inhaling through the mouth, what happens now? There is no sort of thing is happening. The air, the polluted air would be directly entering the respiratory tract. So we are more prone to infection, right? So what we have to do? We have to consciously inhale through the nose, exhale out through the nose only. And there are some cases, there are some pranayama in which the exhalation through the mouth is suggested. Exhalation through the mouth is suggested. We will come to that later on, why that is suggested. Okay. So as a pranayama practice, when you are doing that pranayama, it is okay to exhale through the mouth. But you are not supposed to make it as a habit of all the time exhaling through the mouth only. Got it, friends? Yes. So which is the right way of breathing? You have to inhale through the nose and exhale through the nose. Okay. You are not supposed to do it by means of your mouth. Okay. Then the next thing, most of the time, how we would be doing, we would be sitting like this. Okay. We would be drooping our shoulder like this. See, when you are reading, you would be sitting like this. Okay. When you are looking into the phone, you would be sitting like this. When you are working in the computer, we would be sitting like this. See, when we sit like this, what you are doing now, you are drooping your shoulder. In such a case, you are restricting the space in this thoracic cavity. Okay, the space in the thoracic cavity is getting shrunk up. Okay, then what happens? So there won't be enough space for the lung to expand. Okay, so that is why in the pranayama activity, not in the pranayama activity, don't make it a habit that don't droop your shoulder like this. Okay, when we do so, the lung cannot expand enough. In such a case, you are inhaling the oxygen, right? The oxygen you are inhaling, but that oxygen can't reach each and every cells of the lung. Okay, because what you are doing, you are not giving the enough space for the lung to expand. You are sitting like this. So what happens now? See, observe. See, this is the wrong way of breathing, friends. Observe this man. This man is drooping his shoulder. How about this man? This man is standing erect. When this man is doing so, his thoracic cavity is getting shrunken up. So he is not giving enough space for the lung to expand. So if that is the case, what happens, friends? If that is the case, what happens? See, observe the air you would be inhaling. No, the inhaling air would be entering here in the respiratory tract. But since here you are drooping the shoulder, strengthening your thoracic cavity, the air would be staying here only. It would be staying here only. Okay. Yes, it won't descend down to the bronchial tubes. In such a case, even though you are taking enough oxygen supply inside, that oxygen is not going to be used up for your body. And the lung would be having so much of carbon dioxide. Since you are shrinking your lungs like this, only the carbon dioxide from the upper part of the lungs would be expelled out. Part of the carbon dioxide would be staying inside. Got it? Then what happens? Then in the wrong way of breathing. So absolutely what I have told you. So when you are inhaling, your abdomen should come out. When you are exhaling, your abdomen should go inside. Whereas in the wrong way of breathing, for most of the people, what happens now? When they inhale, the abdomen is going inside. When they exhale, the abdomen is coming up. So in such a case, what happens? What happens? For example, see, let us see, the person is inhaling. Okay, the inhaling, that time his abdomen is coming inside. When the abdomen is coming inside, the diaphragm from its normal position, again it is moving upwards. When it moves upwards, it pushes the lung upwards. So the lung won't get the space for its expansion. In such a case, you are inhaling, okay, but the lung cannot expand properly. In such a case, just like I told you in the previous image, only the whatever that you are inhaling, that would be staying here only. It won't descend down up to the bronchial tube, and from the bronchial tube, how it can reach up to the alveoli and how the exchange of gases would be happening. So you would be mostly active only in your upper lobes of your lungs. Only you are making use of only the upper part of the lungs. The other part of the lungs are left unused. Okay, then what happens? You are exhaling in the wrong way of breathing. While you are exhaling, the abdomen is coming out in the wrong way of breathing. Okay, while you are exhaling, what should happen? The lungs should get shrunken up so that all the carbon dioxide getting accumulated are expelled out. Whereas, since you are bulging out the abdomen while you are exhaling, the diaphragm comes down. In such a case, the lung expands. If the lung expands, how the carbon dioxide from the lungs would be getting thrown down? So the carbon dioxide would be staying inside. Okay, so these are the effects of wrong breathing. So what you are not supposed to do, you are not supposed to breathe in and out through your mouth. The breathing in process and breathing out process should happen through the nose only. First thing. Then the next thing, all the time try to keep your spine erect. Don't droop your shoulder. Okay, that is a habit we are making. Okay, when you are watching the television, you are sitting on the couch, we think that it is comfortable to lie down like that. But what we are doing now, you're going to interfere with the process of breathing. Okay, so try to keep your spine erect, especially doing the pranayama. Okay, that is why I will be telling you need not sit on the floor. You need not sit on the floor and do the pranayama in a cross leg posture. You can sit on the chair also. You can lean against the wall also. But the thing is, your spine should be erect. Okay, then the next thing, when you inhale, the abdomen should come out. When you exhale, abdomen should go in. You have to be careful of that. Okay. So this is what we have to watch out for. Right. Then the next thing. What happens when you are getting into the habit of breathing wrong? For example, you are all the time drooping the shoulder. You are inhaling and exhaling through the mouth. Okay. And the wrong breathing pattern, when you inhale, abdomen goes in. When you exhale, abdomen goes out. In such a case, what happens? Right? See, when you are doing so, what you are doing now, you are creating, in case of wrong breathing pattern, you're not giving enough space for the lung to expand during the inhalation process. So oxygen won't be enough for your body. Only whatever you are inhaling, for example, if you are taking 100% oxygen, you would be only making use of 20% or 32% of the oxygen only. And when you are exhaling also, what happens now, since the abdomen is coming out, okay, for example, if you take, that is 100% carbon dioxide staying inside, but only 20 to 30% of the carbon dioxide would be going out, and remaining 70 to 80% of the carbon dioxide would be staying inside the body. So what happens? See, the elevated carbon dioxide level is the reason for our mental fogginess. Okay, if that is the case, the oxygen level will be low in your body and carbon dioxide level would be much higher. In such a case, we cannot think properly. We won't have clarity in our mind. Our perception would be wrong, right? And we lack concentration and focus also, right? So the oxygen level should be good. Then next, what happens? Since the carbon dioxide level is high and the oxygen level is low, it is going to change the biochemistry of your blood. The biochemistry of the blood is much important. The blood is a very important thing. The blood is a carrier. Okay, the blood is a very important vehicle that carries the nutrients, everything to each and every cells of the body. Whereas what happens, since you are going to change the biochemistry of the blood, since there is not enough oxygen supply, it is going to disrupt the circulation of the blood or the movement of the blood. Okay, so what happens in such a case? Then even though you are eating the nutritious food, the nutrition cannot reach the cellular level. Okay, see, for burning, you are getting the nice food. Okay, whereas the energy that you are having, no, if you want to make that energy to be used up by your body, in such a case also, you need oxygen supply. If there is no enough oxygen supply, you are eating the food, but the food cannot be converted into energy and it cannot be used up by your body. So you may think that, oh, I am eating the nutritious food, but all the time I'm not having enough energy. All the time I'm feeling so tired. Like that it would be. Okay. Then the next thing, since it is going to change the biochemistry of the blood, your blood is going to turn acidic. If the carbon dioxide level is going to be elevated, it is going to be elevated all the time. It is going to turn the blood in acidic nature. Okay, so the acidic nature of the blood, it would result in all sorts of inflammation happening in the body. Not only the blood would be acidic, so it is going to inflammate your body. Your GI tract would be inflamed. You may end up in problems like acidity complaint, ulcer complaint, all sorts of inflammations like PCOD, PCOS. Everything is an inflammation. And this represents that acidity level is high in our body. Okay, and if it is getting prolonged, if the acidity is so high, what happens now? It would happen in the case of cancer patients. For the cancer patient, acidity would be in their body is so high, like that. Got it? So I am not threatening, but these are the possibilities. Okay, right? So what we have to do? We have to breathe right. So first let us check. So first you have to check all by yourself. Are you breathing right? In case if you are breathing wrong, okay, see all through the life we are breathing wrong. In case it has been a habit for them. In case what we have to do now, the pranayama practice we would be doing, no, you have to daily do that pranayama. Okay, and you have to, when you are doing that pranayama on a regular basis, your breathing habit will change. Within 1 week or 10 days, it will change. When you all the time bring your observation to your breath, when you breathe out consciously, whenever it is possible, you are cooking, you are driving in the car, you are driving in the scooter, okay, you are talking to some people. In such a case, you can bring your attention to your breath. Am I breathing right? Like that also, you can keep your awareness. By doing so, within 1 week or 10 days, you can correct your breathing pattern. Okay, now let us move on to the pranayama techniques to correct our breathing pattern. It is also called as abdominal breathing or diaphragmatic breathing. Okay, observe. You have to sit comfortably. Okay, sit comfortably. Now, keep your left hand over your chest and your right hand over the abdomen. Left hand over the chest and right hand over the abdomen. Now what you have to do now? You have to inhale. Okay, then you have to exhale. While inhaling, your abdomen should come out. While exhaling, your abdomen should go inside. Okay, inhaling, forcibly bring the abdomen out. Exhaling, forcibly take your abdomen in. Okay, and while inhaling, you are inhaling through the nose. While exhaling, you are exhaling out through the mouth. Okay, just now I told you, no, there are some techniques, pranayama techniques, where the exhalation through the mouth is advisable. Now let us see why the exhalation through mouth is happening. After doing that, after experiencing that pranayama, you yourself can see all by yourself. Now let us move on. Keep your hands like this, your left hand over the chest and your right hand over the abdomen. Now inhale through the nose. Forcibly bring your abdomen out. Then exhale through your mouth. Say ah. Open the mouth wide and say ah while you are exhaling. Take your abdomen in. Continue for 3 minutes. I will alert you after 3 minutes. Gently open your eyes. How are you feeling? Feeling so calm from inside? Yes? Feeling so calm. Right. See why it is happening now? By forcibly bringing your abdomen out, you are deepening the depth of the breath. Okay. The depth of the breath closely relates to our emotions. Okay. Have you ever observed your breath when you are angry, when you are so sad, when you are so depressed? Every thought you have, every action you make, every emotion you experience influence your breathing. Every thought you have, every action you take, let me repeat again, every thought you have, every action you take, every emotion you experience influence your breathing. Got it, friends? See, whenever you are in a negative emotion side, you are feeling so depressed, you are feeling so sad, you are getting angry, you would be much active here only. Your breath, the breath would be much shorter, it would be much shallower, and the frequency of taking breath would be much higher. Okay. Whereas when you are staying more calm, more at peace, that times what happens now? We would be deepening the depth of the breath. When the depth of the breath is much deepening, the frequency of taking the breath would be decreasing, and it would help to balance our emotions. Okay, it would help to balance our emotions. That is why while you are doing this, what you are doing now, you are deliberately elongating the depth of the breath. Deliberately elongating the depth of the breath. That helps to calm down our mind instantly. And how about breathing out through your mouth? When you are breathing out through your mouth, you are giving more space, you are giving more enough gates to send the carbon dioxide out. One thing. Then the next thing, breathing out through the mouth is a way to send out all the bent up emotions, all the bottled up emotions. When you are breathing out through your mouth, it helps to send the emotions out, bottled up emotions out in a very positive way. Got it? So, in case of pranayamas, like this diaphragmatic breathing, and in pranayama techniques like Shitali, Shitkari, breathing out through the mouth is suggested. Okay, so breathing out through the mouth, only you have to practice by practice while you are practicing these kind of pranayama. You are not supposed to make it into a habit. Got it? Yes. So this is one breathing. By the way, you can, there is no contraindication for this breathing. Anyone can practice. Even the small kid and the elderly people, everyone can practice. This helps to increase their energy level. This helps to make you more calm, more focused, more alert, right? Helps to balance out our emotions also, right? Then the next breathing that we do all the time, do in our class. Okay, that is called balloon breathing. Okay, either you can keep your palm facing up or you can keep your hands in Chin Mudra. Close your eye. Imagine your lung to be a balloon. Imagine your lung to be a balloon. Okay, when you inhale, what happens now? You have to fill in the same way the balloon gets fills up. Okay, you are blowing the balloon. Okay, how the balloon gets filled up? When you blow the balloon, first the lower part of the balloon gets fills up. Then middle part of the balloon gets fills up. Then the upper part of the balloon gets fills up, right? And when you release the air from the balloon, how the balloon is get emptying out? First the air from the upper part of the balloon goes out. Then middle part goes out. Then the lower part goes out. The same way, fill up your lung. Okay, when you inhale, first take your inhalation breath to the lower part of the lung, middle part, upper part. When you exhale out, first exhale out from the upper part of the lung, middle part and lower part. If you find it difficult to do the process like this, see how it is possible to bring the air first into the lower ear. No worries. Just when you are inhaling, first bring your attention here. Then slowly take your attention here, and finally your attention should be here. While you are exhaling, keep your attention here first, then here and last here. That's it. Okay. Shall we move on? 3 minutes of breathing. Start. Your spine should be erect. That is the criteria. You can sit comfortably. No worries. Keep your hands in Chin Mudra or your palm facing up. Close your eye. Simply open your eyes. Relax. How are you feeling? Feeling more calm, right? Yes. So these are the two techniques that helps to correct your breathing. Okay. Two techniques to correct your breathing. Now we will see about one more technique that also we normally do in the class, Ujjayi breathing. Okay. So the Ujjayi breath helps to deepen the depth of the breath. Diaphragmatic breathing and balloon breathing helps to correct your breathing pattern. The breathing pranayama technique that we are going to see now, it helps to deepen the depth of the breath. Okay, it is Ujjayi breath. How to take the Ujjayi breath? The inhalation and exhalation should touch the inner part of your throat. This part of your throat, the epiglottis. So here, there is a valve here. Okay, so that valve is nothing but just like a lid. Okay, so that lid helps to close the digestive tract when you are inhaling. And when you are eating the food, that lid will help to close your respiratory tract, because the respiratory tract and the digestive tract share a common path here. From here only, they would be getting separated. Okay, when you are eating, that time the food should not enter the digestive tract. If the food is entering the the food should not enter the respiratory tract. If the food is entering the respiratory tract, we will end up in suffocation problem, right? So it is a protective mechanism for our body. There will be a lid when you are eating, that lid would be closing that respiratory tract. So it would be situated here, and the inhalation, exhalation breath should touch that and go in and come out. Most of the time people would be asking, what is the inner part of the throat? I cannot understand. So which is the right place? I don't understand the concept of epiglottis, something like that. That is okay. Now let us do it with an experiment where to locate that place. Okay, if you are not having the knee pain, and if you are very young enough to jog for a minute, please everyone rise up. If you're not having the knee pain, and if you're young enough to jog for almost 1 minute, you can rise up and jog. Okay, now we would be jogging for almost a minute. Okay, then you have to observe your breath. You are not supposed to force your breath. You have to just stay all of a sudden, and you have to observe where your inhalation and exhalation is touching your body inside. Okay, yes, everyone start jogging fast. Jogging fast, fast, fast. For 1 minute, we would be doing fast, jog fast, fast, fast. Make it fast, make it fast, fast. Fast, 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 fast. Make it fast. Now stop, friends. Stop. Observe your breath. Where your breath is going, you are not inhaling through your nose. You are inhaling and exhaling through your mouth. And where the inhalation and exhalation breath is touching, it is the inner part of the throat. Observe your breath. You are not inhaling through the nose. The inhalation, exhalation is happening through your mouth, and where it is touching. Observe. Have you observed? Yes? Now let us do Dauti. See, inhale through the nose, exhale forcibly through the mouth. Now, inhale through the nose, exhale forcibly through the mouth. Yes, 2 for 6 times. 6 times. Yes. When you are done now, close your eyes, observe your heart. Just wait until your heartbeat comes to normalcy. Close your eyes. Feel your heart. Feel the increased hike in the pulsation of the heart. Relax. Relax yourself. Now please be seated again, friends. So have you observed? As soon as doing the fast jogging, okay, did you did you inhale and exhale through your nose? No, it didn't happen. Where the inhalation and exhalation happened? It's through our mouth only. And where it touched? It touched the inside of your throat, right? Yes. So that is the place the Ujjayi breath has to touch. When you inhale and exhale, this is the place it has to touch. Why now? See, when you are jogging fast, fast. That time, you are building up so much of carbon dioxide. Okay, the oxygen requirement is high and our body produces more carbon dioxide. Okay, you are stopping it, everything all of a sudden. Okay, so since the carbon dioxide level is very high, it is the protective mechanism of your body to help you for surviving because the oxygen level, carbon dioxide level is elevated much. It is the protective mechanism. When it comes for a protective mechanism, your body is tapping into the hidden potential from your body. Hidden potential from your body. That is from Mooladharam. That is why the breathing is happening here, not through the nose. Got it? Yes, that is why we are breathing from here. When you have you ever seen the persons in the air? Bedridden person, last at the time of their death, how they would be breathing at the time of their death. Like that they would be breathing. Okay, see why it is happening? It is the body's attempt to cling on to the dear life. Okay, it is tapping into the hidden potential. That is why it's happening. Okay, in Ujjayi breath, we are mimicking that action. Okay, we are tapping into the hidden potential of the body. So when you inhale and exhale, what you are doing, the inhalation breath and exhalation breath should touch this part of your throat. Okay, now shall we move on? We will do 3 steps. Okay, step 1, step 2, step 3. Okay, first step, keep your palm open up, close your eye. You are inhaling through the mouth and exhaling through the mouth this time. Okay, you are inhaling through the mouth and exhaling through the mouth this time. Step 1, you have to do for 9 rounds. Start. The inhalation and exhalation breath should touch the inner part of the throat, and you have to visualize that while you are inhaling, the waves are rising up in the ocean. When you exhale out, visualize that waves are falling down in the ocean. Observe your oral cavity. வாய் வழியா சுவாசத்தை உள்ள இழுத்து வெளியே விடு. Observe your oral cavity. Feel your throat. Relax. You are getting a cooling sensation in the throat. This represents that your internal organs are getting cooled down. So you can do this breathing if you are having any kind of inflammation happening in the body. It helps to cool your body down, helps to calm you down, helps you to stay more at peace. Okay. Then step number 2, the same breathing, but you have to close your ear with the index finger. You have to inhale through the nose, exhale out through the mouth. This time, inhale through the nose, exhale out through the mouth. 11 rounds. Same breathing, same visualization. Waves rising up, falling down. It should touch the inner part. Start. Observe your earlobes this time. Feel your ears. Feel the chillness happening in your ears. Feel your mouth. This time you are salivating. You can see the improvement in the secretion of saliva. Simply open your eyes. Have you observed? Yes. Now third step. Okay. Again the same thing. Close your ear. Inhalation, exhalation, this time through the nose only. Okay. And the same visualization, waves rising up, falling down. Okay. 9 rounds. Let us start. Observe your earlobes. Feel the chillness there. Observe your state of mind. Gently open your eyes. How you're feeling? You didn't want to open your eyes, right? So this is how this breathing takes. Okay, and you are feeling the chillness in your earlobes, right? Your ears are closely relating to your kidney. Okay, yes. So which gland is over the kidney? It is the adrenaline gland. And which hormone is produced from the adrenaline gland? The cortisol hormone. The cortisol hormone is responsible for our fight or flight reaction. It always keeps us in the stressed mode. Okay, cortisol is hormone that helps us to cope up our body, help us to cope up with the situation in our stressed mode. Okay, so what we are doing now, by doing this breathing directly works on your kidney over the adrenaline with a cortisol production. Since the cortisol production is being checked out, it helps to calm down our mind. When the cortisol production is there, we would be entering the sympathetic mode. Sympathetic nervous system is getting tapped into. Whereas when we do this breathing, what you are doing now, you are tapping into the parasympathetic nervous system, which is responsible for rest, rejuvenation, and relaxation. Okay, that helps to calm down your mind instantly. Okay, so the breathing that we are doing now, Ujjayi breathing, the third breathing, that is a very important breathing that helps you to stay more focused, at the same time more calm and peaceful in your mind, more focused, more concentrated. Okay, so the first two steps is the no, step 1 and step 2. So those two are just a preparatory steps so that you are getting proficient with the third step. Actual breathing is step 3 only. Okay, when you are doing it as a pranayama, you have to do these 3 steps. Step 1, step 2, step 3. Okay, step 1 and step 2 will help you to be more proficient with the last one. Whereas this Ujjayi breathing you can do at any time of the day. Just like I told you, you can while you are driving the car, driving your cycle, riding your cycle, or you are cooking, you are working on the computer, that time also you can take this Ujjayi breath, but only step 3, the last breathing we are doing now, closing the mouth, inhaling and exhaling. So that is, you are doing it as a habit, so you have to do only step 3. Whereas when you are doing it as a pranayama, you can do all these steps. Got it? How this helps you now? This pranayama help you to tap into the hidden potential of your body. Okay, helps you to stay more energetic. In Kerala, martial art would be there. Kalari martial art would be there. In Kalari, in each and every step they are taking, they would be taking an Ujjayi breath. For example, when they keep their hand like this, if they do their hand like this, they would take Ujjayi breath, because it is a martial art. Anyone may attack from anywhere. The focus should be more, your concentration should be more, alertness should be more. At the same time, they have to stay more calm. If and only if that is so, they can perform well. Okay, so Ujjayi breath is a must. Got it, friends? Yes, so this is all about the breathing. Yes, you have any doubt, friends? So these 3 breathing techniques we have learned. Okay, one is diaphragmatic breathing, one is balloon breathing, the last one is Ujjayi breathing. Okay, so there is no contraindications for these pranayama. Anyone can practice, anyone can do at any time of the day. Only thing is, you are not supposed to do immediately after your meal. Immediately after your meal, you have to give a gap of immediately after a heavy meal. If you are having the lunch, leave at least a gap of 2 to 2.5 hours. Then you can do. Okay, at any point of time, you can do, friends. And you have any doubt regarding this? You can ask me, or else we can end the session.